Next is about granthi apachi arbuda galaganda nidana. अथा तो ग्रंथि अपचि मांसम असक्त्यदुष्टाः सन्दूष्य मेधश्च कफानुविद्धं वृत्तोन्नतं विग्रथिवन्तशोभं कुर्वन्त्यतो ग्रन्थिरिति प्रतिष्ठः. Now, the granthi is defined as a lesion which is presented with as a either circular or globular and having a raised surface and having a vigrachita. Vigrachita is having a this knot like in the sense knotted in the sense now, having a capsule or maybe a covering over that area and the contents are being inside. Now, and it's produced due to the Vatadi dosha, Mamsa, and Asvikarakta, and Medas also is involved. And that's what's called as a cyst. Now, in the present day situation, the cyst is translated as a cyst is a sac-like pocket, Vigrachita, sac-like pocket of membranous tissue that contains fluid, air, or other substances. Any of the other substances that are presented as they are called as a cyst. Now there is a bit of issue of controversy also. The granthi and arbuda, these are considered as these two separate issues. Now, in case of the granthi, the types are vataja, pittaja, kafaja, and medoja, whereas the features of the arbuda are also the same in case of vataja, pittaja, kafaja. Whereas Asragarbuda, Medoja Arbuda, they are mentioned differently. So, and Siraja Granthi is mentioned as a separate issue. So, there is a bit of controversy about the identity of Granthi and Arbuda. I'll come to that part later. But in case of the Granthi, a cystic condition, in general, when there is a pain, ayamyate, vyachyate etitodam, pratyasya krityate etibhedam, krishno amraduhu, vastiriva atadascha, binnasravetcha anirajo asramacham. Vataja granthi is a hemorrhagic cyst. Now, hemorrhagic cyst is any cyst, rather the chances of this hemorrhagic cyst are more in case of the ovary. So usually, whenever we say hemorrhagic cyst, it's almost related to the ovarian cyst. Of course, it can occur in any other cyst also. A cyst which is there present for a long duration, which is a dilated condition, and if there is a bleeding in, that produces an acute pain. There will be a sudden increase in the size of the lesion that produces the pain, and that color of the cyst would be changing according to the presence of the blood. And that's exactly what Sushil has mentioned as the acute pain. IMA which is IMA is something like pulling down, better is as if something is twisted or pressed as such, or to them pricking like sensation. So different sorts of the acute pain sensations. Pratyasya is as if it is being thrown out, Krityasya as if being is cut. So these are all the different descriptions of the acute pain. So I would say translate this as an acute pain, and the swelling tends to become Krishna, blackish, and mruduhu, or somewhat soft, or some the consistency being irregular. Bastiriva atataha, it may have a fluctuation. It is evidence of the fluctuation, dilated like a bladder, and whenever it is open, it produces the discharge would be blood stained or like a frank blood as such. Anilajo asramacham. Now this is a typical of the hemorrhagic cyst. A hemorrhage is usually a complication of any of the cysts, more frequently in case of the ovarian cyst as such, which presents with the acute pain, and that's exactly the Vataja variety of the Granthi according to Sushra. The difference is we now consider hemorrhage as a complication of the cyst, whereas Sushil had considered that hemorrhagic cyst as a type of the cyst as Vataja. That's the difference. Now, whenever there is a features of dandashyate, dhupyati, chushyate, chapakachyate, prajwalati, vachapi, raktaha, chapitopi, athawa pipittat, bhinnasrave, lushnam, ativachastram. When the cyst would present, the granthi would present with a burning sensation, heat, local heat, temperature being raised, or as if the patient feels like as if it is being cooked, as if it is being cooked, or prajwalati, as if it is a burnt, caught, flame, inflamed as such. So it's all the signs of acute inflammation, and when the swelling would have reddish or yellowish color, and when it's open, you would have a hot contents or the contents which are hot. It's a typical of an acute inflammation. So a cyst which tends to get inflamed acutely, that's considered as a the pittaja variety, pittaja granthi. Now, again, the same issue. We consider infection as a complication of the cyst, whereas Sushruta had considered this as a variety of the cyst. That's it. Now, in case of the Kapaja Granthi, Shito Avivarnaha Alparujo Atikanduhu Pashanavad Samhananopavannaha Chiraviruddhishta Kapaprakopat Bhinasrave Shukla Ghanancha Puyam. One of the possible complications of the cyst or some rather termination of the cyst would be it may be calcified. The contents may become calcified, and particularly these are more common in the cysts which are exposed to the pressure parts of the body, like the ganglion cysts which are present over the tendons, or it can occur in any of the cyst as such. Calcification is one of the possible termination of any inflammatory pathology. Cysts also may have a mild inflammation, and when there is a deposition of the calcium, which is to separate that tissue from the normal part of the body, it becomes harder. The symptoms of the pain will be lesser. There will be virtually no or minimum effect upon the system of the body. All that symptom will be local symptoms. Now that's exactly what Sushra has said. शीतः अविवर्णः अल्परुज अतिकण्डुः पाषाणवत् संहननोपपन्नः. When the consistency becomes hard like a stone, that's a point which has to be noted very clearly. Chirabhivriddhishta, when there is a very slow growth, and sarves shukla ghanam cha puyam, whenever it is open, it may produce a whitish and relatively solid or maybe semi-solid thick discharges. That's exactly what we see in case of a calcified cyst as such. No, so calcified cyst is the Kapaja Granthi. So these are very clear. Like Vataja Granthi is a hemorrhagic cyst, Pittaja Granthi is an infected cyst, Kapaja Granthi is a calcified cyst. In the present day situation, we consider these as three stages of the same cyst as such, whereas Sushra had considered these as the three varieties of the cyst as such. Then शरीरवृद्धि क्षयवृद्धिः स्निग्धो महान् अल्परुजो अतिकण्डुः मेदं कृतो गच्छति चात्रभिन्ने पिण्डाप्रसर्पे प्रतिमं तु मेधः. A mesoja granthi, there is a very typical feature that it would have a increased or reduced visibility depending upon the condition of the body. If the person becomes somewhat obese or the body gains weight, then the cyst becomes less visible, the granthi becomes less visible, or when the body becomes leaner, the granthi becomes more visible. Now, whenever a lesion may become more visible or less visible depending upon the condition of the body, that's suggestive of that lesion's involvement with the subcutaneous tissue, fat tissue. The simple logic is whenever there is a gain or loss of the weight, the maximum impact would be on the fat tissue layer of the body. I don't say the impact is only on the fat layer of the body. It would be in all the areas, but the maximum impact would be the fat contents. So whenever there is a weight loss or weight gain, the maximum impact would be on the fatty layer, and any of the structures which are present in the fatty layer, they either become more visible or less visible depending upon the thickness of the fat. Now, it's not that the size increases. The lesion size may or may not increase. That's not the point. The point is it becomes more visible or less visible. So, when Sushruta says Sharira Vriddhi Kshaya Vriddhi Hanihi, it's about the suggestion of the lesion being in the subcutaneous tissue. Now, there is a bit one more of the issue of a bit diversion. When Dhalana has commented on the word Sharira Vriddhi Kshaya Vriddhi Hanihi, he has commented as a Vruddha Vruddhi Kshaya Kshaya. But I would translate in the opposite way. Like the Dhalana's comment is when the size of the body increases, the lesion also increases, and size of the body reduces, or the condition of the body is somewhat leaner, it becomes a thinner. This is what Dhalana has commented. I think that kind of interpretation may not be practicable, may not be demonstrated clinically, whereas the interpretation of what a Sharira Vruddho Kshayaha, and hano kshaye vruddhi. That's how it has to be interpreted. So it's a bit diversion from what Dallana has said, but I think this becomes more clinically relevant. Now, anyway, then the lesion becomes is presented as a snigdha, smooth, and alparujaha, painless or less pain, atikanduho, and whenever it is ruptured, it produces a discharge which looks like a cake. Pinyakasarpi pratimamtamedaha. Either the discharge is cake-like or maybe ghee-like. Now, this is very typically seen in case of the sebaceous cyst. Sebaceous cysts are more common in the subcutaneous area because sebaceous glands are in the skin only, and it's a sort of retention system. When the contents are retained in, that's the retention cyst as such, and it becomes dilated, and that's exact, almost perfect picture of the same. Like, because it is the subcutaneous tissue, the visibility can change according to the thickness of the fatty layer, and it is relatively painless, and whenever it is opened, you will find exactly the same description. So mesoja granthi is the sebaceous cyst condition. Then comes the Siraja Granthi. Siraja Granthi is Vyayama Jati Apalasya Dehi Akshipya Vayu Sira Pratanam Sampidya Sankochya Vishosya Japi Granthim Karoti Unnatam Ashuruttam Granthi Sirajaha Sataprachasadyaha Bhave Yadisyag Sarujaschalasta Aruk Sayevapi Achalom Hamsta Marmuktitaschapi Vivardaniya Iti Granthina Nidanam Samaptam. Now, whenever due to some abnormal form of the exercise, when it results in a impairment of the functions of the siras, any vessels, of course, here in this condition, we'll take it as a veins, which results in sampidya, sankocha, vishoshachapi. Either it could be that the vessels may be compressed, or the vessels may be constricted, or vessels may be dried up or thrombosed. So, any of these complications, either compression, constriction, or the thrombosis as a complication results in unnatam ashvartam, a bulged swelling. That's the Sirajak Granthi. And very important that is when it becomes painful, when it is in the initial stages, when it is painful, that's Krishna, it can be cured with difficulty. But when it is painless and it's not movable, size is bigger, then it's vivardhaniya, cannot be cured. Now, this is exactly the clinical description of varicosities. Varicose veins are dilated veins, and the veins are dilated because there will be more blood flow than what the capacity is, or when there is a defect of the perforating veins. As in case of the deep vein thrombosis, complication of the deep vein thrombosis, because the deeper venous system becomes blocked, the superficial venous system may have to carry more blood, and that results in dilatation. Or when there is a abnormality of the perforating veins, in the normal situation, the blood will flow from the superficial veins to the deeper venous system, and this flow is maintained by the guarding valves. Valves are either at the saphenous opening, and then you have the connecting perforating veins or connecting veins, maybe bit 3 above the knee and 3 below the knee, or number can vary. And whenever there is a defect of these walls of the perforating veins, there will be reverse blood flow, and that results in the dilatation. And characteristically, as the blood vessels are dilated, varicose veins are dilated, they are painful. The pain would be more in the initial stages. Later on, once it becomes established, fully dilated, the pain will become lesser because the tissue gets adapted to that situation, or whenever there is a thrombosis, that also can result in a painless condition. So that's exactly the clinical description of the varicosities. And the causes of the varicosities also are the same, where there is a lack of exercise or maybe a compression in the abdominal or the deeper venous system. That's about the granthi. Now the next is about the abhati. The Hanvasti Kakshashka Bahu Sandhi Manya Gareshu Pachitam Tumedaha Granthim Stiram Vrutam Atha Ayatamva Snigdham Kafascha Alpurudam Karoti Tam Granthi Visto Amal Kasti Matrehi Matsyanajala Pratimi Tata Anihi Ananya Varnehi Upatiyamanam Taya Prakashad Apatim Mudanti Kandu Yata Hate Alpurujaha Prabhinaha Sravanti Nashyanti Bhavanti Janye Medak Kapabhyam Kalurogeshaha Sudustaro Varshaganan Vandi. Now, whenever there are multiple swellings, and the multiple swellings they tend to occur in an area as if either they are cumulated together, adhered together, or they are discrete. Now, Sushruta has given the two words Matsya Pratima or Amalakasti Matra. The Amalakasti Matra, like the seeds of Amalaki, which do not stick to each other, but when you have some many of the seeds, you can easily identify these as separate entities. Whereas Matsya and Jala, the eggs of fish are usually seen over a gelatinous matrix and they are adherent to each other, and it's always presented as a mass with irregular surface. Now, this is exactly what you see in case of tubercular lymphadenitis or non-tubercular lymphadenitis. Lymphadenitis is an inflammatory pathology of the lymph nodes, particularly in tubercular lymph node lymphadenitis. There would be an initial stage where the lymph nodes are single and they are swollen, the periodinitis, the swelling or inflammation over the external surface of the lymph nodes are characteristic, and that results in this other lymph nodes nearby to stick over to the area, and it presents as a matted appearance. I see matted appearance is a palpable, and or by ultrasonography that matted appearance can be seen. Later on, it may result in a cold abscess and there could be even pus formation also. And characteristically, these tubercular lesions, they tend to rupture and they may be temporarily healed, and then again they may rupture again, and they may either produce multiple sinuses or recurrent sinuses. That's the typical presentation of a tubercular lymphadenitis, and that's exactly what Sushruta has said. Sravanti, Nashyanti, Bhavanti Chandi. The swellings could be discrete or they may not be adherent to each other in case of either neoplastic lesions, or it could be like non-tubercular lesions like Hodgkin's disease. Hodgkin's disease can present with the again lymph node enlargement where the lymph nodes may not be adherent to each other. Now, whenever they are not adherent to each other, you need, and periodontitis is absent, either it could be a lymphoma like Hodgkin's or other lymphomas, non-tubercular neoplastic lesions have to be suspected, and they may not separate, they may not have the pus formation, but they tend to become very chronic. Varshagananubandhi and Sudustaraha, they are difficult to be treated. So, lymphadenitis, either tubercular or non-tubercular, may be considered as the apachi. The word apachi is because of Chayat Prakashatar, because it tends to go on progressing and doesn't end up, doesn't have the termination. See, Paka otherwise would have a ending separation, then when it doesn't, the Paka doesn't separate, end in the lesion, terminate the lesion, it tends to become more chronic recurrent, that's considered as apathy. Now the next is about the arbuda. Now there is the issue is arbuda is very commonly translated as cancers. Now, there is some you have to look at it with some reservations. I don't say that the Barbuda being translated as cancer is not wrong, but all cancers or all neoplastic lesions cannot be considered as Arbuda. Arbuda is related to Gatra Pradeshe Kotileva Doshaha Samurchitaha Mamsam Abhipradusha Vrittam Stiram Mandarujam Mahantam Analpamulam Thiravriddhi Apakam Kuruvanti Mamsopatayam Shopam Tamarbudam Shastravido Vadanti. A neoplastic lesion now is translated as a palpable mass as maybe with the specific characters. I will come to that part. Now, Sushruta has considered the arbuda as again a palpable mass, and the palpable mass, a mass can be palpable with the clinical impression when it is presented over the surface of the body, and Sushruta has limited to the surface of the body. Gatra Pradeshe Kochideva. Gatra is the surface of the body, visible surface of the body is the Gatra, and there when it is the lesion are seen over the surface of the body, and there is a involvement of the mansa or the soft tissues of the body, and the lesion is presented as a vrittam, a globular surface, a leaf shape, and stiram, fixed. The lesion is fixed, painless, comparatively painless, mandarajam, and analpamulam. This is again the induration. Analpamula is the induration. Induration we have referred to, discussed in the previous chapters, like whenever we have discussed about the Shotha. And Chiravriddhi, when it becomes, it's a slow progressive, apakam doesn't separate, such a lesion is considered as arbuda. Now, arbuda cannot be translated as a tumor because when we define the word tumor, the tumor is defined as a new growth which is having an independent character and it has atypical formation and it has no useful function, no termination. The meaning of this would be independent growth is the normal growth is dependent on variable factors, environmental factors, the factors surrounding area, and so on. This mutual relationship with the neighboring tissues and the hormones and so on. So there is a control of the growth. Now I will not go into much detail about that dependency. That it's a very huge issue. What's that dependency of the growth? In general, dependency is normal. Independence is a malignant, suggestive of a neoplastic condition. And atypical means the cells do not have the normal shape. A normal shape of the cells in a tissue is identified with the typical characters. Right? Whereas in case of a neoplastic lesion, there could be either abnormal shape, pleomorphism, the shapes of the cells may become abnormal, or they may have a atypical arrangement of the cells instead of having the normal alignment, they may be haphazardly arranged and they tend to become more de-differentiated. Differentiation and differentiation is a process where the embryo, which is a single cell, which goes on multiplying, and at each multiplication, it attains certain specific function. And in an adult body, you will have different generations of the cells, different tissues like adipose tissue, skin tissue, nerve tissue, and so on. A skin tissue cannot grow into another tissue. It has only that potential of being the skin. If at all you remove a skin tissue and allow it to grow, it only grows into a skin tissue. Or a fat tissue will grow into fat tissue, muscle tissue will grow into muscle tissue, and so on. Now, this kind of a character of attaining a special character function, and maybe at that it may be at the cost of multiplication, ability to multiply is called as a differentiation. And in the normal growth, embryonic cell, which is totipotent, which has the capacity to produce every form of the cell, it grows into multipotent or pluripotent and then it becomes a unipotent. In adult, it's a unipotent. This process is a gradual ascending in attaining the functions, and that's what you call as the differentiation. Whereas if a cell reverses or if a cell division produces a reverse in that condition and it grows back to the same, then it becomes a de-differentiation. That's what it's the process. And it doesn't have a useful function and the tumors do not have a termination, they do not end up. Now the point is, a diagnosis of a tumor is based upon microscopic findings. This definition of a tumor is based upon microscopic findings, and these cannot be made out only by the clinical issue assessment. Whereas a arbuda is a palpable and a clinical diagnosis. All tumors need not be presented as a, or all neoplastic lesions, sorry, all neoplastic lesions need not be presented as a palpable mass. Conditions like leukemias, there may not be a palpable mass. It's only that cell differentiation which has to be identified by the microscope that you may diagnose this as. And hence, translating the arbuda as a neoplasm may not be absolutely correct. Whereas a tumor, the word tumor, it refers to an abnormal mass of the tissue that forms when the cells grow and divide more than they should or do not die when they should. Now, this is what the current description of a tumor. That means they do not have the dependency. Either they should they do not divide or divide more than what they are supposed to do, or they do not die when they are supposed to die. Now, that's exactly what we mean by the independent growth. Then tumors may be benign or malignant, and benign tumors may grow large but do not spread into or invade nearby tissues or other parts of the body. Malignant tumors can spread into or invade nearby tissues. They can also spread to the other parts of the body through the blood system, and they are also called as neoplasm. Now, this is what the Universal Webster Dictionary defines the tumor. It's not a technical definition. The technical definition is the first one which I have mentioned. Now, this dictionary differentiation or dictionary definition of the tumor is very much close to what Sushruta has said. Like it has a property of having no termination, it doesn't end as such, and it may have a growth which is deep inside. Now, the pattern of that growth as such is initially it starts as a growth which is having a this limited lesion, and then it may spread. The pattern of the spread of the lesion, Mahamula, the mula of the arbuda, may spread in different fashions, and these are now defined with the different code names like type 1, type 2, type 3, and so on. And type 4 and type 5, they are capsulated. They have a capsule. So when the lesion has become capsulated, usually that's considered as a benign, which may not spread, but not necessarily. But when the tumor invades into the nearby tissue, that's considered as malignant, and the word cancer refers to the same issue. The pattern of the invasion will be of these different shapes based upon the studies. Now, anyway, the types of the arbuda are Vatena, Pittena, Kapena chapi, Raktena, Mamsena cha Medasa cha, Tajjayate, Tasya cha Lakshanani, Grantehe Samanani Sadabhadanti. Now, Sushruta has said the granthi and arbuda have a similar clinical signs. Whereas Charaka has mentioned a situation where the all the features of the arbuda and granthi are the same. Now I'll come to that part. Whenever Sushra has mentioned about this Samana Lakshana, Granthi Samana Lakshana, is the Samana Lakshana is about Vataja, Pittaja, Kapaja, Granthi alone. Sushra has not mentioned a separate clinical symptoms of Vataja, Arbuda, Pittaja, Arbuda, Kapaja, Arbuda. These symptoms are supposed to be the same. Whereas Raktaja Arbuda, Sushra has mentioned a sign different than the Siraja Granthi. Siraja Granthi is representative of the same. Then Mamsa, there is no specific mention of Mamsa Granthi, whereas Mamsa Arbuda is mentioned. Medas, the Granthi is mentioned. So there is a bit of confusion about this issue. Now, among those arbudas which are specified by Sushruta as arbuda, lakshanas of arbuda, beyond the granthi, one is the asraga arbuda, the rakta arbuda. And the rakta arbuda, the clinical symptoms are dosha pradisto, rudhiram sirasto, sampidya, sankotya, gatasto, apakam, sasravam, unnahyati, mamsapindam, mamsapurihi, achikam, ashurajim. स्रवति अजस्रम रुधिरम प्रदुष्टम असाध्यमेतत् रुधिरात्मकं स्यात् रक्तक्षयोपद्रव पीडितत्तु पाण्डुर्भवेत् सो अर्बुदपीडितस्तु. Now, a Raktaja Arbuda or Asraga Arbuda is presented as a initial small lesion which is presented with the vascular complications, vascular issues, either Sampidya, Sankocha, and it doesn't separate, doesn't have a pus formation, and gradually it tends to increase in size, and later on it may present with a fleshy swelling, a swelling which may be visible and may be having a soft mamsambre, polyp-like surface, irregular surface can be seen, and the rate of the spread would be, rate of the growth can be faster, rapid, and it may produce a frank bleeding. Now, this is exactly how a carcinoma, surface tumor, tends to develop. See, initially there would be one cell with altered growth mutation, then it results in hyperplasia. Initially, it could be hyperplasia, and then gradually the changes would occur. The growth will become altered, and it may become a dysplastic. The cell may become changed as such. Now, or in due course of time, it may become a in-situ cancer. A cancer is where you have all those features like atypical arrangement and having independence, growth independence. Now, once it becomes independent, it becomes a regular, this rapid growth. It competes with the neighboring tissue for the nutrition, and hence it grabs the nutrition, and hence you will have the systemic complications like anemia and so on, which are the complications of the malignancy. So, Ashwagandha is very much specific to the malignancy of the surface, maybe the cancers. Carcinoma, cancer is epithelial tissue. I don't limit only to the cancers, even any other surface tumors which are malignant. That's exactly the clinical description of the Ashwagandha, where you have the systemic features like Pratakshayopatropidratvat Pandu, there would be signs of anemia and so on, the systemic signs, and locally it's a fragile and infiltrated swelling, and it can have a rough surface or a polyp-like surface, mamsam prehachitavuddin, So these are the exact description of the asal arbuda. Then the next variety of the arbuda mentioned is a Mamsa arbuda. Susha has not mentioned about the Mamsa granthi, but Mamsa arbuda is mentioned. Mustik praharadivi ardite ange Mamsam pradustam prakaroti shopam avedanam snigdham ananyavarnam apakam ashmopam aprachadyam pradusta mamsasya narasya bhadam etad bhavet mamsa parayanasya Mamsa arbudam tvetad asadhyamuktam. Mamsarbuda is more frequent in the persons who tend to consume more non-vegetarian diet and having a hefty body. And whenever there is a injury to the muscles, the body, with a blunt trauma, either it could be mustik prahara, it could be like being hit by somebody else or otherwise, a abnormal tissue, soft tissue, presents with a swelling which tends to become painless, which is painless characteristically, and there is not much of a change in the color, which may become hard, stony hard, and doesn't move, immobile. That kind of a swelling is called as the mamsa. Now, this kind of a situation can be exactly similar issue can be seen in what we call as muscle herniation. See, muscle herniation is usually seen in persons who do rigorous exercise and who have a very strong built body, bodybuilders or maybe players or so on. Kapil Dev had that the muscle herniation in the thigh. Now, whenever there is a muscle herniation, when the muscle is relaxed, the swelling is not seen. If the muscle is made to contract, now these two are the pictures of the same person, same patient. Relaxed muscle, you don't see a swelling. When the muscle is made to contract it, you'll see a swelling which is hard depending upon the tone of the muscles and it's painless. Usually, these muscle herniations do not require any treatment. They are harmless conditions. They do not require any treatment. If at all there is a need for treatment, it has to be surgical treatment repair only, but they are harmless and virtually they do not produce any complications in almost all situations. So, muscle herniations are one of the frequent seen conditions in bodybuilders, sports persons, and so on who do rigorous exercise, and of course, they also have that bodybuilding diet, that kind of issue, and it tends to result in a herniation of the muscles, and that has the clinical features of the Mansarbuda. Now, Sushila has said, Sadhyeshapi imani varjayet samprastham marmani yacca jatam srotasva yacca bhavet acharyam yajjayate anyat khalpuru jate jneyam tadadhyarbudam arbudajnehi yadvanda jatam vigapakramatva dirarbudam tacca bhavet asadhyam. The complications of the arbuda and the condition prognosis of the arbuda is dependent on one, the location of the arbuda. If the arbuda is located in vital areas like srotas, a lumen, and then produces obstruction, like a mass in the esophagus may produce obstruction to the flow, swallowing, and then it may produce its own complications, and it becomes more difficult to be treated, or which tends to rupture and bleed. A rapid growing ulcer, arbuda, also is considered as an incurable or acharyam when it becomes immobile. Now, in addition to these, the other two important issues mentioned issues are Adhyar Buddha and Durar Buddha. Adhyar Buddha is Yajayate Anyata Khalapuru Jate Jnayam Tadadhyar Buddham Arbudajnihim. When a growth occurs over a pre-existing growth, as you see in this picture, initially the growth may be having a smooth surface, but now when you palpate you that see the irregular surface. Now whenever you find any such swelling where the tumor or mass has such irregular surface and irregular consistency, somewhere it's softer and somewhere it is not so softer, that's a sign of rapid growth, malignancy. Malignancy, because the rate of growth in some areas is more and some of areas lesser, the surface becomes irregular. Now, this kind of a feature is always considered as a feature of benign to malignant conversion. A benign tumor may become malignant. This is one of the risks in that. And if there is a mass which was smooth and having a uniform consistency earlier, becomes now at the next visit when you see either the size increases rapidly or it becomes more indurated or when it has become having a irregular surface, that's a sign of malignancy. That's exactly what Sushila has mentioned as a Adhyar. Then the dural Buddha is a metastasis. Metastasis is a formation of a lesion elsewhere. A Dvanda Jadam Yugapata Kramapa. initially there could be one lesion, and later it may produce a multiple lesion which may spread through either the local spread or through the bloodstream or through the lymphatics or through the body lumen, the cavities of the body, and that kind of a spread into the other areas is durable, which we call as metastasis. नपाकमायान्ति कपाटिकत्वात् मेदो बहुत्वात् विशेषतस्तु दोषस्थिरत्वात् ग्रथनात् तेषां सर्वार्बुदान्येव निसर्गतस्तु. In general, the arbuda do not separate, and the reason given by Sushra is because there is a kapha adikya and a medo bhutvat. And most importantly, dosha sthiratvat grathanacha. Dosha sthiratva and grathana. These are the two specific words. A sthira dosha is one where the once the dosha has formed, the next generation of the doshas also would be defective. Say a defective dosha leads to the defective further defective doshas. The dosha santati, the next generation, that's the dosha sthiratva. This is exactly the feature what you see in case of a neoplastic lesion. Once the cell has become neoplastic, the next generation of the cell also will be neoplastic. It produces the neoplastic conditions. Then grathana, grathana is a when it tends to bind and it becomes or involves more and more of the tissue. It knots forms. That's the infiltration character. Spreads. Now these are the reason why it doesn't separate. This is what Sushil says, and of course, among the non-suppurative lesions seen now, neoplastic lesions are number one, and the reasons for the non-suppurative is exactly the similar issue where there is no inflammatory pathology and it's a abnormal growth of the tissue. Now the other part is according to Charaka, the differentiation between the granthi and arbuda is nil. Granthi arbudanam yato avishesha pradesh hetvakriti dosha dushehi. ततश्चिकित्सेत विषगर्भुदानि विधानवित ग्रंथिचिकित्सेन. According to Charaka, there is absolutely no difference in case of the etiology, cause, and the clinical features, involvement of the doshas, and even the treatment. There is no difference between Granthi and Arbuda. Naturally, that leads to a question like why there should be two names. Whereas Sushruta says, again, he uses the word like there is a similarity of the clinical symptoms of the Granthi and Arbuda. And as far as the Vataja, Pittaja, Kapaja, Granthi are mentioned, they are exact, and Vataja, Pittaja, Kapaja, Arbuda, there is no differentiation in the clinical symptoms. But when it comes to the Chikitsa treatment, there is a difference in the treatment for Granthi and Arbuda. We will come to that part when we go into the Chikitsa. Whereas the Mansa, Medas, and Raktaja, that the Arbuda and Granthi are mentioned separately. Now, so that's a part of bit controversy or maybe a issue of dispute. I think we are not going to that part. I will consider this as a sign of evolution of the knowledge. So there is a evolution of the clinical perception, and this differentiation of the Granthi and Arbuda was mentioned very specifically in Sushruta. With this, the Arbuda is over. The next part is about the Garaganda. वातः कपश्चैव गले प्रवृद्धो मन्येतु संसृत्य तथैव मेधः कुर्वन्ति गण्डं क्रमशः सुलिङ्गैः समन्वितं गलगण्डम् आहुः. Now, Sushruta has mentioned the involved doshas of Vata and the Kapha, which locates in the neck area and involves the medas and produces a swelling that's Galaganda. There is again a bit of this difference of opinion between Charaka and Sushruta about the Galaganda and Ganda in Charaka and Sushruta about the word Galaganda. Charaka has mentioned about a Gandamala where when there is a single swelling that's called as a Ganda, and when there are Bahubi Ganda, multiple swellings, they are considered as Gandamala. Sushruta has not used the word Gandamala. Instead, the similar features are mentioned in the Apache. Apache where you have multiple swellings. So that's a bit of maybe a difference of nomenclature in Sushruta and Charaka. But Sushruta has specified about Galaganda as a solitary swelling in the neck area. Now, तोदान्वितः कृष्णशिलावनन्तः कृष्णो अरुणो वा पवनात्मकस्तु मेदोन्वितश्च उपचितश्च कालात् भवेत् अतिस्निग्धो अरुजः पारुष्ययुक्तः चिरवृद्ध्यपाकः यदृच्छया पाकं यात् कदाचित् वयस्य हासस्य तस्य जन्तोः भवेत् तदा कालुगलप्रशोषः. The typical features of the Galaganda are like they are tend to be bilobed. I will come to that part. So I have mentioned that at the end of the chapter. A bilobe swelling in the neck. So most of the times the Galaganda relates to the thyroid swellings. Now thyroid swellings which we see could be of different origin. One autoimmune or the infective or maybe the deficiency induced, or what we call as the iodine deficiency goiter. Primarily these three. Then of course the tumors are the next. Hypertrophy and tumor are the next variety where you will see the goiters. Now, whenever there is a infective pathology or infective thyroiditis, the area of the thyroid would be hyperemic. Even if you operate upon, when you this operated specimen of the thyroid will show the evidence of the hyperemic swellings. And clinical features also would be of a short duration. There would be pain and local tenderness, which is typical of the Vataja. Krishna Siravanantaha, Krishna Arunova, Vataja Galaganda, according to Sushruta, is almost the clinical signs of infective pathology. Whereas in autoimmune condition, once you open upon like thyroid, Hashimoto's thyroiditis or reduced thyroiditis conditions, the thyroid gland would show a pallor and relatively firm consistency. Now that's exactly what you see in case of the Kaphaja variety of the दलगण्ड स्थिरः सवर्णो अल्परुकु उग्रकण्डोः शीतः महांश्चापि कपात्मकस्तु चिराभिवृद्धिं कुरुते चिराच्च प्रपच्यते मन्दगजः कदाचित् माधुर्यं मास्यस्य तस्य जन्तोः भवेत् तथा प्रलेपः. Now, the Kapaja Granthi or Kapaja Galaganda would be having a paler swelling and it's firm as such and having no tenderness or minimal tenderness. That's exactly the feature of autoimmune thyroiditis. Now, there are two other descriptions when it is opened up, when it is ruptured. In case of Vataja Galaganda, it produces Asya Vairasya, whereas in case of Kapale Galaganda, it produces Asya Madhurya. Now, this is something which we are not able to make out or which is not mentioned in the current the clinical science. But of course, the patients would have some sort of this variation in the appreciation of the taste. Anorexic symptoms could be common, but that kind of a differentiation, like Asya virus and Asya madhurya, that's not specified in the current situation as such. Then the Medhole Granthi is a Snigdha, Mruduhu, Panduhu, Anishtagandha, Medakruto, Nirugu, Atikanduhu, Pralambate, Alabuvatu, Alpamulaha, देहानुरूप क्षयवृद्धियुक्तः स्निग्धास्थितः तस्य च भवेत् जन्तोः गले अनुशब्दं करोति च नित्यम्. In the Medoja Galaganda, it's a huge swelling which is having a pedunculated appearance, solitary swelling, and having a pedunculated appearance, pralambate alabu, like a alabu, having a narrow pedicle-like swelling, and it produces even hoarseness of the voice, producing a compression of the laryngeal nerve. That's very typical of a deficiency goiter, iodine deficiency goiter, when the size becomes bigger. And the surface is smooth and painless, slowly grows as such. That's exactly the picture of a iodine deficiency goiter, where the swelling is essentially huge. Either it could be unilobular or bilobular. Very often it's bilobular. Whenever it produces bilobular, the swelling would be having a shape of course, we'll come to that part, what Sushma has mentioned. The features of Nibaddha Shvaitulyasya Mushkavat Lambate Gare Mahanva Yadiva Hriswaha Galagandam Namanshetam. Sushma has defined the shape of the Galaganda as either Mushkavata, like a scrotum, when it is bilobed, or when it is unilobular, it's considered as a alabuvata. Now, these descriptions are again very classical and easy to understand. A bilobed swelling which resembles that of a scrotum and a unilobular swelling which resembles that of alab. These are all the specialities of Sushruta which have to be appreciated. Now, the prognosis of Galaganda are Krichatshvasantam Mrudusarvagatram Samutsaratitam Marochakartam Kshinam cha Vedyah Galagandinam tu Bhinaswaram Teva Verjayat. Now, a Galaganda which presents with the Mrudu Sarvagatra, where the whole body is softer and having bulky edematous appearance, that's what we call as a mixed edema, which is a typical clinical sign of hypothyroidism. And hypothyroidism also would have an appearance of the facial expression where the eyebrows are thinner and there is a periorbital edema. The face becomes puffy, so that's a Mrudu Sarvagatra. The features of the Mrudusarvagatra and Krichashasandam, or when the patient has a breathlessness, and Bhinnaswaram, when there is a huge size and then produces the hoarseness of the voice, that's considered as asadhya, and samvasaditam when it is for a more than year. Of course, hypothyroidism presents with these clinical symptoms, whereas hyperthyroidism presents along with this the clinical appearance of a exophthalmos, the emaciation of the body. Mixed edema can be present in both the conditions, softness. So, in a soft swelling, presents with the expression of periorbital edema and eyebrows become thinner, puffy face. It's a typical appearance of or features of hypothyroidism. When it is presented with exophthalmos and tachycardia, weight loss, and so on, that's considered as a sign of hyperthyroidism. So, maybe when Sushra has mentioned about that asadhya lakshana or prognosis, we may have to refine, re-add these clinical features of hypo and hyperthyroidism and make it more specific. Now, the last part is about the same which we have discussed earlier. The general shape of the Dalaganda are compared to the Mushka, bilobular settings, and they could be either size is bigger or smaller. They are called as a Dalaganda that confirms about the thyroid swelling. Now, with this chapter is over. It is social sometime nidana sthane Galaganda Gandamala Apachi Arbuda Nidana Nama Ekadasho Adhyayah. If there are any questions, we'll try to answer the questions and then there is one question. Exophthalmos will be no. In the exophthalmos, the size of the eyeball is not increased. Instead, the fat tissue in the periorbital area is increased, and hence the eyeball is pushed to the forward side. So its eyeball gets pushed as such, not really the eyeball size increases. And as it is pushed, the eyelids will be retracted. So usually you will have three stages: retraction of the eyelid, and then the exophthalmos as such. So that's how we grade the exophthalmos. So it's actually a mechanical displacement, right? So no other questions. So we'll wind up today.